So we are all going through the same crisis. And I heard Preetham speak. I really wish I could dress what I'm going to talk differently, but I suppose it's going to be nearly the same. So some of you are allowed to go to sleep. So here I go about the OPD guidelines. Just a minute. Shrey? Just a minute. I think it's not moving to the next slide. So I think I'll just go ahead and talk. Okay. Yeah, no, I'll just talk without the slides. So I really don't understand why it's not changing to different slide. So basically, these are some precautions which are very specific to our OPD management, and we need to see how we can be specific about dealing with it. So some of what Preetham had already said, that history taking when the patient comes to your hospital are something which is going to be just about the same, like a detailed history of his travel or coming from a hotspot, and ensuring that they wear a mask and use a hand rub, and being very strict that there should be only one attender or no attendee at all. Once you enter the OPD area, we have to ensure that there's a space seating, and definitely be very particular that there is no crowding at the reception desk, and the receptionist should be on a very active drive to prevent this. Probably if your space allows, you could even have 2 reception areas, and even more so if you have 2 floors where OPD is being seen, you ensure there are 2 reception desks and keep a separate counter for your tele-appointment patients. Again, cash counters should be multiple because that's another area where there could be crowding and we need to deal with it. Of course, we are not presuming at all that we are going to have a crowded OP. It's just that this is our ways for social distancing. And of course, ensure that every staff and doctor wears a reusable N95 mask. As far as the specific clinics are concerned, like if a patient comes in with redness or conjunctivitis, he should be directly sent to the allocated room where the attending doctor is going to be donned in a PPE. And these patients should not be allowed to mingle with the rest and sent off with medications. But when it comes to dealing with the specific subspecialties, these tend to be a larger floor, and there is a delay which are inherent, especially in glaucoma, retina, and pediatric. So a triage would have to be specific to each department with specific receptionists and counselors to deal with each of them. Every effort has to be made to speed up the evaluations. And like, for example, if it's a glaucoma patient, we should take a call that we are not going to be doing a fundus evaluation for a routine patient or a goni or an intraocular pressure unless it's specifically indicated for that particular glaucoma patient. Again, the pediatrics should be quite totally segregated with their specific evaluators. Staggering of appointments, we should insist on appointments for all our patients to what feasible extent. And of course, all of us have walking patients and they do tend to come more in the morning. So we have to stagger our regular appointments to early or late afternoons. We have to send a mass SMS to our entire database and tell our patients that we are going to work on appointment system, keeping the COVID disease in mind. And reviews and appointment patients should be clearly in the afternoon. Again, as all was said, timings of OPD have to be increased to accommodate spacing out of patients. And we should encourage teleconsultations, which is going to happen. But again, we have to keep them a different slot, especially when the crowds tend to be temporarily wane off. We have to be very encouraging in our counseling to our patients during the time when they're waiting in the OPD about how hygiene and self-protection, especially at the reception and the waiting areas. We should have a TV display on which specific instructions at different time points would keep coming in, especially the OPD is more at that time. We should ensure that 70% isopropyl alcohol is used for cleaning all instruments, headrest, chin rest, everything which has already been said. And also those frequently touched areas have to be cleaned at regular intervals. Housekeeping cleaning has to be done by the guidelines, and our patients should see them clearly visible during when they are sitting in the OPD, because that's quite reassuring to the patients that we are following all the guidelines. And as far as the pre-op workups are concerned in the OPD, we have to closely monitor that we do a very adequate follow-up with all the evaluations, with the physician evaluation in every single case, and a COVID testing is mandatory. And we should ensure that our operated patients are discharged as early as possible the very day, and that has to be ensured. And again, in the opticals and the pharmacies, we should ensure spacing because that has to be a critical measure. There tends to be crowding there, and keep gently explaining to the patients. And we have to see that the frequent post-op reviews are totally taken care, lessened, and even the review numbers really become down. So essentially, what is most important in our OPD area is to improve the happiness quotient of our patients and ensure a secure feeling for all of them during their time with us. Thank you.